Well, thank you everyone for joining today. We're going to do some just housekeeping and introductions as people join, but I really want to thank all of the attendees as well as NCAI sister organizations for helping develop this webinar, especially so quickly. So we were able to give you all the information you need about this really important legislation as you're developing comments. So first of all, Chemai, my name is Megan Bishop, and I'm a member of the Native Village of Afognak in Alaska. And I'm the Director of Policy for the National Congress of American Indians. And thank you for coming to this overview of the Native Children's Commission Implementation Act draft discussion webinar, where we will be discussing Senator Murkowski's draft legislation related to the 29 recommendations that came out last year from the Commission on Native Children. The intent of today is to review the legislation and provide you the information you need as you're reviewing it and making comments. Senator Murkowski has requested comments on the legislation by September 12th, and she will use those comments to improve the legislation before she introduces it at some point next year. Just a couple housekeeping things. We are recording this today with the intent of putting it on the NCAI YouTube page so you can refer back to it or link it out to your partners who were not able to attend. The slides at the end will be made available on the NCAI website. In addition, we will not be taking questions via raised hand today. We have quite a bit of information to get through. So what we would do is if you can go to the bottom of your Zoom screen, there is a box with a question mark and underneath it says Q&A. So if you do have any questions, please put them in the box. We'll try to answer them if we have time. If not, we'll collate the questions and put them in a document on our website and also send it out to our participants list. So with that, I'm going to turn it over to our panelists today and have them introduce themselves. We'll start with Anita.
Thanks, Megan. My name's Anita Fineday, and I had the honor of serving as a commissioner for several years to work on the Commission on Native Children. I am the former chief judge for the White Earth Nation, where I'm an enrolled member. Thank you. I'll pass it over to David.
Good afternoon, good morning. I guess it's afternoon everywhere except for Alaska. I'm David Simmons. I'm the Government Affairs and Advocacy Director for the National Indian Child Welfare Association, and happy to be here. I'll pass it on.
Hi, I'm Jay Spahn. I'm a citizen of the Cherokee Nation and Executive Director for the Self-Governance Communication and Education Tribal Consortium.
And good morning or good afternoon to many of you. Kendra Kloster. I'm Director of Government Relations at the Alaska Federation of Natives and a tribal citizen of Tlingit and Haida.
I think it's moving on to me. My name is Holly Cook-Macaro. I'm a principal at the Angle, and here on behalf of the Tawahe Coalition tribes and specifically Red Lake, which was one of the initial demonstration sites. Thank you.
Hello, everyone. Kayla Gaybeck. I'm principal at Gijaglaw. I'm a member of the Red Lake Band of Chippewa Indians, as is Holly, she forgot to mention, and I'm here on behalf of the Native Farm Bill Coalition.
So hello, everyone. My name is Julia Wakeford. I'm the Legislative and Federal Policy Director for the National Indian Education Association, and I am Yuchi and a member of the Muskogee Creek Nation.
Good afternoon, everyone. My name is Wynn Davis. I am the Congressional Relations Director with the National Indian Health Board.
And good afternoon, everyone. My name is Blythe McWhirter. I'm the Federal Affairs Associate for the National American Indian Housing Council. I'm very happy to be here.
Thank you so much to our panelists. So the structure of today is going to be defined by the draft legislation. We'll be first hearing from Anita Fineday on on the work of the commission, and then we'll be going title by title, section by section, providing summaries of the legislation. And if there are any recommendations from any of the groups presenting here, we'll provide some recommendations for you to think about as you're developing your comments. So with that, I'm going to turn this over to Anita so she can talk a little bit about the commission as well as the work.
Thanks, Megan. I'm just going to say a few words. I wanted to give a little bit of background about the commission and to let folks know. Probably some of you have forgotten how long we were in business. I was appointed by President Obama to the commission. President Obama had the opportunity to appoint commissioners, and this was in the last few days of his administration. And then the next administration had the opportunity to appoint commissioners. And then we had to wait for the the new Congress that came in to appropriate funding. So there was no money at the beginning. And so we had to wait for Congress to give us money to do the work. And that happened, it took a little bit more than a year for us to actually have an operating budget. And then COVID hit. So we had multiple delays. We did a lot of our work virtually, but we felt like there were a lot of places that we needed to see. There were a lot of places that we wanted to visit and a lot of people that we wanted to meet, hopefully in person. So we finally submitted our report last summer. And one of our last conversations was about that we hope that this report did not sit on the shelf. We hope that people would use this report, and we hope that this report would become widely disseminated. So I'm hoping that that's happening now, and I'm hoping that the report is useful. I think that we covered a lot of territory. We didn't cover everything, and we had to make some decisions along the way about things that we would leave out. But we tried to cover the big buckets of work that we thought were ongoing and that were important for the federal government to be engaged on. So I'm thrilled that everyone is here and talking about the recommendations of the report. And I would just look forward to the conversation. Thank you so much.
Thank you so much, Anita. We appreciate your work and the work of the commission. I had the pleasure of attending a number of the hearings, and they were really wonderful, impactful, as well as the site visits. And so I know every single one of the commissioners put in a lot of time, energy, and work to come up with the 29 recommendations that really address every single facet of tribal children and families. And there was a lot of thought put into them. So moving on, we're going to move on to the actual draft legislation. So next slide. Oh, I'm on the wrong screen. So the title of the legislation, or the title right now, because this is the discussion draft, is the Native Children's Commission Implementation Act of 2025 discussion draft. It was released as a response to the Way Forward report. We have links to both the discussion draft and the Way Forward report at the end of the slides. The Way Forward report had 29 recommendations, and the draft legislation has taken into account every single one of those 29 recommendations and has addressed them in some way through 44 provisions across 9 titles, impacting everything from child welfare, justice, research and data, physical and behavioral health, environmental health protection, nutrition, housing and homelessness, education, workforce development. There was a SKIA roundtable in Anchorage, Alaska last week actually, I believe it was on the 14th, with Senator Murkowski and a number of parties from Alaska that had stakes in this legislation. And Senator Murkowski, both in her news release and at that roundtable, has welcomed additional feedback to further improve the legislation. You're going to hear this a few more times, but she requests her feedback, or she requests feedback to be presented to her by September 12th. So moving on, I believe we will be moving on to Dave Simmons to go over these first few sections in Title I, Child Welfare.
Thanks, Megan. In developing the child welfare title and the different sections and amendments here, and Nicole was involved in and also provided testimony during the commission's data gathering time. But the theme here is really about trying to get more resources, more federal funds into the hands of tribal governments so that they can create programs if they don't have them, or essentially increase their capacity to do more with programs that already exist. One of the key statistics that I always remember is that tribal governments only have access to about 1/2 of 1% of all of the federal funds that states have access to for child welfare services. And so closing that gap is what these three sections, 102, 103, and 104 do. Section 102 from the Social Security Act programs under Title 4B increases this tribal set aside from the current 3% to 5%, and this will increase funding significantly. It also tries to make the program a little easier to operate, so it's very explicit about making sure that tribes can also have increased funds for court improvement, streamlining reporting application requirements, being able to use their funds when they want to for tribal customary adoptions from Title 4B, being able to use their tribally negotiated indirect rates as opposed to what the statute requires for states, and then being able to also use third-party in-kind sources to help meet tribal match that's required under the law. Section 103 seeks to achieve, for the first time, tribal set-aside under the Social Services Block Grant. This is a program that's funded at about $1.7 billion every year, and states are the only ones that have access to it. It's a highly flexible funds. They're used for everything from elder protection to child welfare, child care, and a number of other things, disability services. And so we're seeking here to establish a 5% tribal set-aside from what they call Title 20 of the Social Security Act or Social Services Block Grant. And the last section here is the federal government's dedicated law and funding for child abuse prevention under the Child Abuse Prevention and Treatment Act amendments. So here we're endorsing an amendment that will increase the tribal set-aside from 1%, which is actually a shared set-aside with migrant populations currently, to 5% for tribes separately from the community base, so they can create their own prevention programs. This is not a program that has a lot of funding in it, but it's only been able to fund about 1 to 3 tribes a year, and we want to increase that significantly. So it is a discretionary program too. Okay, next slide, please. I'll go ahead and I've got a couple of, as a number of us do, we have different sections that we're working on. So I'm going to have a couple in Title II here. So the first one is creating a tribal advisory committee under the Office of Juvenile Justice Prevention Department over at the Department of Justice. Juvenile justice in general is not funded really well under the federal government for anyone, but especially for tribal governments. And in this case, we're trying to get more tribal input because at OJGP, tribal structures, tribal consultation is something that happens, but not nearly as often as it should. And so we're establishing amendments that will create a TAC, a Tribal Advisory Committee, to cover a number of the issues around juvenile justice and how they impact Native youth. Our take on this from NCWA is that this is really a very positive, should be supported. We do have some things we think that could be clarified to improve the amendments, and that would be to also examine alternatives to incarceration. Currently, it's not clear if that's how strong the focus will be in that area under this language. Also, some cross-system collaboration. We know a lot of children who end up in juvenile justice systems have been seen by other program areas and services before. And then also to make sure that there's a look at how can we better support tribes to be able to intervene in state juvenile justice proceedings and increase their capacity to operate their own programs and services. So it's a very positive amendment. We're happy to support it. We're hoping that there'll be some further examination of a couple of these clarifications. I'm also on section 202. This is the Department of Justice and Bureau of Indian Affairs study on a number of American Indian Alaska Native missing children cases. This is another really positive amendment, something that's been needed for a long time. We know that there are significant numbers of Native children who also go missing. We believe that this should be endorsed. We do ask for a clarifying amendment to include children who are missing due to non-custodial parent abduction. So it's not clear in there. Most of this study is going to look at children who are missing based on criminal circumstances, and we think that the parent abduction, non-custodial parent abduction, is also a significant issue that we see in our practice too. So with that, I'm going to now pass it on to who's going to do section 203. I think that's
Kendra.
Kendra. Yeah.
Great, thank you. So looking at section 203, which is the Alaska Native Victim Services Fund at the Denali Commission. And this is a part that's going to be authorizing funding for these grants to assist tribal and nonprofit organizations serving Alaska Native victims of crime. And for those that may not be familiar with the Denali Commission, it was set up back in 1998, and it's been a really important agency for us here in Alaska, as we are, I think many of us face unique challenges. So for Alaska as being home to 229 federally recognized tribes, very rural in most of our areas, only accessible by boat and plane, making things very expensive and very difficult as far as broadband as well, and how we're being able to access resources and whatnot. So they have, with the Denali Commission, we've been able to be a partner with them in order to help streamline some of those funding things so we can get accesses to funding. And so this has been an important partnership so we can continue to get our funding for infrastructure, for health programs, for victim services, for many other things out to our rural communities.
Thank you, Kendra. I think we then go back to David. David, you're on mute.
Okay, you can probably hear me now. Section 204 addresses a number of Senator Murkowski's Family Violence Prevention Services Act provisions, and that address a number of different programs and services. Some of the funding under this law supports the Alaska Native Women's Resource Center, Strong Hearts Native Domestic Violence Hotline Grant, and then other training and technical assistance services and grants to tribal domestic violence coalitions too. What the amendments here do is that they expand and they clarify some of the resources under this law. Now, this law has about $175 million authorized, so it doesn't have a lot. It's not one of the larger programs in the human service side. But the way that the funds are divided up, it goes out to set-asides for tribes, set-asides for technical assistance and training centers, set aside for domestic violence coalition work, and then also some established funding for domestic violence hotlines as well. So currently tribes are one of the national training and technical assistance centers. And in this set of amendments, they want to expand it to have there be a Native Hawaiian resource center established, an Alaska Native resource center established, also a tribal domestic violence coalition section specifically for grants to those coalitions, and then also a Native domestic violence hotline program as well. And so all of these programs would be funded under the existing set-asides that are established under the law. So this is another set of amendments that we're also saying should be supported. And what we would like to know a little bit more about sort of how, since there are going to be more grantees, more entities funded, how under the current authorized funding levels how will this impact support for Native centers and grantees if they're using existing funds? Okay, and I'll pass it along for section 205.
Holly.
Thanks, David. For folks who are not familiar with the Tawahe Initiative, I'll just take a second on background. Tawahe means family in Lakota, and the initiative supports coordinated services delivery among tribal programs and with state and federal programs at Interior. It has given tribes over the last 10 years the flexibility to build structures that really reflect tribal views and tribal cultural traditions that are specific to individual communities. With Tawahe, the BIA connects tribes to 7 program areas. And this legislation is really significant where the council and coordinating and pilot sites are really excited that this legislation will make the Tawahe program permanent. It is a fairly short section. It also establishes the coordinating council, and we will have draft comments for folks to include. I think probably the most specific piece is increasing the authorization level to 100 million in order to, in the long view, accommodate the, sorry, my other phone is ringing, to accommodate the expansion of the program. So we're working to get those numbers together, and we'll have those in the draft comments for you. But this section is also something that we are all supporting. Thank you.
Thank you, Holly. And then we move back to David on the next slide, please.
So in section 301, we've got the Office on Native Children being established, as well as National Clearinghouse on Native Children. So in this section, there will be an office established on Native children at the Department of Interior, and it would house a National Clearinghouse on Native Children. It also allows for an outside organization to be designated as the clearinghouse as well. The clearinghouse will compile federal data, reports, information on Native children and families, collect and share information on federal grant opportunities related to Native children, and then also provide some kind of data liaison to also provide training and technical assistance to tribes and tribal organizations. And there's also, in the way that the amendments are, it also seems that there's a function with this office to also be helping other federal agencies also think about how they work on Native children's issues in their respective programs as well. So in our review of this, it's a really big scope, and it has the funding allowed to or authorized is as needed. So we're not sure how much that might look like, but it's also going to be, when you have a scope this large, we're a little concerned that there might be some issues around which priorities get funded or get attention as opposed to others. So normally, like at NCWA's experience, when you have these kinds of clearinghouses, usually they have fairly large staff allocations, 10 or more people sometimes. And technical assistance work can really take up a lot of resources and time as well. So we really support the concept for sure, but we really have some questions about how the scope would be and if there's a way to clarify and prioritize it so that the functions will be more effectively achieved.
Thank you, David. Wynn, did you want to take this, or do you want me to take it?
I'm okay to talk a little bit about it,
Okay.
Megan.
Sounds good.
Yeah, so the next two sections, section 302 and section 303, are somewhat interlinked, providing for 2 types of committees. The section 302 provides for an interagency committee on American Indian, Alaska Native, and Native Hawaiian Indigenous data sovereignty and tribal traditional ecological practices. The interagency committee would be headed by the Secretary of the Interior and the Director of the Office of Management and Budget. And the focus of the committee would to be guiding federal agencies on indigenous data sovereignty and promote the use of traditional indigenous ecological practices alongside evidence-based methods. Um, when reviewing the information provided for the committee, our initial kind of reaction is that we would like to see either tribal representation on the interagency committee or some kind of requirement for work with the tribal advisory committee that is also spelled out kind of in the same jurisdiction. And then we thought it was interesting the collaboration and roll up of the tribal data sovereignty pieces with traditional ecological practices. And so we make a recommendation to disaggregate those two pieces so that they each get the attention that they deserve. And then in particular for the tribal data sovereignty, much of the data sovereignty movement and data pieces are really guided currently, particularly in the children's space, at HHS. And so we would recommend kind of moving some of these tribal data sovereignty pieces to be housed at HHS and for them to house and work through the new tribal data policies that they have. We also thought that there needed to be some additional research component related to which departments are using evidence-based practices currently. Not all departments are currently have adopted evidence-based practices in the programs that they operate, and getting some type of survey across the different departments that would be participating would, I think, really help and enhance the work that would be done in this space. We had similar recommendations around the Tribal Advisory Committee that's established in 303. So this is a Tribal Advisory Committee on American Indian, Alaska Native, and Native in Hawaiian youth data sovereignty and traditional ecological practices. Again, we make the same recommendations around kind of disaggregation to ensure that both data sovereignty and traditional ecological practices get a strong focus and that those data components, again, be housed over at HHS. One other piece that was, I think, of interest was the focus on youth within the work of this particular topic. There is a lot to be said around how the data components here impact youth. But we thought it might be more productive to have youth members to the committee or youth-focused members and to broaden the TAC qualifications so that you also get folks who have really strong qualifications in the tribal data sovereignty space.
Thank you so much, Wen. And then on section 304, this is a really short section, and it relates to the Office of Native Children that Dave spoke about in section 301. 180 days after the act is enacted is to conduct and submit to Congress a report on the results of of a study on assistance needed by Indian tribes to support capacity and grants management, including burdensome, any information on reporting requirements that may be burdensome. And the purpose of this is to help the Congress learn about what can they do to help Indian tribes take better advantage of federal grants relating to Native children, youth, and families. I think this is a really important piece, even though it's small. In my work in Indian country, I think we hear a lot about how difficult grants are to access and administer. We know that 477, which we'll talk about later, um, does add some relief on the back end once a tribe receives a grant in administering that grant. But what this study will do is look at a the grant process as it relates to Native children, youth, and families throughout government, provide a report to Congress on what the barriers are, and Congress then can use that to legislatively remove some of the barriers and make it easier for tribes to access that grant funding. So we as a group endorse this without amendment. So thank you. And then moving on to section 401 on the next page, I'm turning it back over to Win.
Thank you, Megan. So I'm going to cover each of these sections under Title IV around improving the physical and behavioral health of Native children. One of the really important components as we kind of walk through this is understanding that a lot of Native children's health and mental health impacts are also linked to their relationships with family, in particular their mothers. And so there is a focus in the health space on ensuring kind of those very early steps are protected, resourced, where they really haven't been for some time. So Section 401 would provide for a tribal advisory committee on maternal health. This would be housed at the Health Resources and Services Administration under the Maternal and Child Health Bureau, which has been a long-standing component of HRSA's program work. We we believe very strongly in this. There has really been a lack of focus on Native maternal and children's health within HRSA's programming. The one in particular program right now that exists in that space is actually sent over to ACF and the ANA for administration. We think that there is maybe a different way of going about the current proposal that would codify both the HRSA Tribal Advisory Committee that does exist and putting in a requirement that there is a maternal health subcommittee that could be a standing subcommittee of that particular tribal advisory committee so that this gets the appropriate attention that it deserves within that committee's work. The second section here is 402. It would create a set aside of maternal and child health services block grant for Indian tribes. Currently, the maternal and child health block grant, which is administered through HRSA, which is a part of the Social Security Act, is about an $800 million grant every year that's sent out to the states to work in the maternal and child health space, providing funding for states to do training and workforce development in the space of new moms and children. Currently, tribes do not have access to this funding. If they do have access to it, it is usually through the state. And so we strongly support this recommendation. We would recommend an increase of the set aside from 5% to 15% in recognition of the underfunding in this space. But generally, we endorse this very strongly. Section 403, a study on the intersection between maternal mortality and domestic violence. This would create a study done at HHS that would look at the link between maternal mortality and domestic violence. We would make a recommendation that there is additional tribal collaboration built into the statutory language, which right now is really focused on the agencies doing the research. We think that by statutorily requiring tribal collaboration and requiring that it be tribally driven research will build a much stronger set of empirical data based in the tribal perspective, and that the work should also, bring in collaboration with the Department of the Interior, where a number of these justice components live, as well as the Department of Justice, particularly the findings from the Not Invisible Act Commission report that came out several years ago. And then finally, Section 404, the Substance Abuse Mental Health Services Administration Tribal Technical Advisory Committee. We endorse this without amendment. We believe very strongly in the need to stand this up and make this a permanent tribal advisory committee. Next slide. The next section is Section 405, which is a codification of the Secretary's Tribal Advisory Committee. This is one of the most important tribal advisory committees that exists in the federal government, particularly because of all of the programs that HHS, as the largest domestic agency, focuses on. We generally endorse this without much addition. We do believe that there could be some improvements, particularly by adding a requirement for one meeting annually within Indian country. This is already a practice of the Secretary's Tribal Advisory Committee, but having it built into the statute, I think, makes that much stronger. And then we would also recommend additional resources so that the committee and the tribal representatives can acquire technical support, and the addition of tribal technical advisors for each representative, which is also a current standing practice of that committee. Section 406 would create a tribal set aside within the community mental health services grant. We endorse this. Our one recommendation is that, again, the amount of funding that be set aside out of this go from 5% to 15%. Behavioral health is an area where there is really continues to be a lack of funding, and this would take what is a current kind of practice within the agency at SAMHSA and turn this into a requirement for a tribal set aside. Section 407, substance use prevention, treatment, and recovery grants for tribes and tribal organizations. Again, this is a really important set of funding. Our one recommendation would be to increase the set aside from 5 to 15%. And again, this really just codifies practice that's happening inside SAMHSA currently. And then finally, I'll just touch very briefly, and then I also want to call on Jay Spahn, who's with us, around self-governance for behavioral health programs for Indian tribes. We endorse this move. This is really important. There aren't currently any programs in behavioral health that have strong self-governance authority. And so we would really support this moving forward. And then I want to call on Jay for any additional remarks on this.
Sure. Thanks, Wynn. So yes, SGCETC, we also fully endorse establishing this demonstration project. We do have a couple of tweaks just that we would like to request to ensure consistency with the terminology of self-determination, self-governance, and some of the sections and references. And then we have another question. We do endorse it, but we do have a question about sort of the process it's laying out for providing funds. In the proposed legislation, it says the secretary shall provide funds to the Indian tribe in an amount that is equal to the amount such Indian tribe or tribal organization would have been entitled to receive under such programs. And then it also further authorizes $2 million to carry out the demonstration project or the demonstration program. So we are kind of interested to see how those two work together. And then we do have a recommendation that instead of having the secretary providing the funds that would have otherwise been provided, that we just open that up to being a negotiation process between the tribes. And this is really largely based on best practices. What we've learned over 30 years of self-governance authority is that really that negotiation is key. You're never sure whenever additional funding might go towards a program, and just having that flexibility for the tribe to be in a position to negotiate is something that we would recommend. But otherwise, we fully endorse this as well.
All right, thank you. So we'll move on to Title V, and we're motoring along. And just a reminder, if you do have a question, feel free to use the Q&A box down at the bottom of the Zoom page. We've already got quite a few questions going on in there, but please feel free to add yours, and then I'll turn it back over to Wynn.
Thank you, Megan. So for Section 501 and Title V, which is really focused on environmental health protections, under Section 501, this section would amend the Indian Healthcare Improvement Act to establish a comprehensive cross-agency task force that would streamline existing efforts to address environmental health threats to Native children. The task force will develop and implement a strategic plan addressing environmental health threats such as dust, mold, contaminated lands, pollution, and streamline application for reporting, data sharing, funding, and emergency response across all of the agencies involved, which include the Indian Health Service, the EPA, HUD, DOI, CDC, transportation, and then would also include tribal organizations, tribal health directors, and tribal environmental organizations as a part of that task force. We endorse this without amendment. And then under Sections 502, integration of environmental health within primary care. This section would amend, again, the Indian Healthcare Improvement Act to enhance healthcare provider training and adjustments to electronic health records to enable providers to track and address environmental health issues affecting Native children more effectively. This is actually a really important component of, I think, this environmental section. One what we know about particularly sanitation facilities and the lack of sanitation facilities in homes is that it exposes our Native children to significantly higher instances of respiratory disease when they're very young. And when those children have early instances of respiratory disease, it can follow them throughout the rest of their life. And so this is really a critical component of addressing the environmental health issues that are faced, in the home, but also in the community. Um, we would endorse this without any amendment. We strongly recommend that this component come with additional financial resources, particularly as it relates to the changes to EHR. In the EHR discussions within the Indian Health Service, the current funding level for the implementation of a new EHR has dwindled over the last several years. And so there's a need to continue to support the implementation of that so that EHR systems can appropriately address this. And there's also been recommendations that any new EHR at the Indian Health Service that is taken up across Indian country include not only interoperability components for other tribes and tribal organizations that use commercial off-the-shelf systems, but that it also include a public health component, which is really important, I think, to this section around the gathering of the types of data that we're hoping to see.
Thank you so much, Wynn. And so Section 503, the Office of Native Children's Environmental Health, is something that ties this together. It is created, it'll be housed within EPA, and it will have a director that is appointed by the administrator of EPA. And it has a number of responsibilities, and its primary responsibility would be to carry out the responsibilities of the Section 501, which creates the new Section 224 in the legislation. It's also going to develop and enforce environmental standards and guidelines to address risks specifically related impacting Native children, providing technical expertise and support for environmental monitoring and assessment in tribal communities, conducting and supporting research on the environmental health impacts specific to Native children, providing scientific and technical assistance to tribal environmental programs. And you've seen this already throughout this proposed draft language, but it's incorporating and integrating traditional ecological knowledge in environmental standard setting and risk assessments. And that's one thing I do really appreciate about this legislation. It also provides demonstration project authority. We would like to see some money attached to that as well. But the demonstration projects and Indian tribes and tribal organizations, nonprofit organizations serving tribal communities, and other entities deemed appropriate by the director can propose demonstration projects to implement or support any of the Office of Native Children, Children's Environmental Health directives. There's also an evaluation piece to it. So in terms of demonstration projects, so they would be evaluating the demonstration projects to see what the outcomes are and see if they can be replicated and across a variety of circumstances in tribal organizations. In addition, there is a tribal consultation requirement, and the director of the Office of Native Children's Environmental Health is required to establish a tribal consultation process that incorporates early, meaningful, consensus-based tribal consultation. And then finally, there is a reporting requirement that after 2 years, the office is to report, and then every 2 years thereafter, to submit a report to Congress that describes the activities of the office, the environmental health risks of impacting Native children, recommendations for assessing those risks, and also finally identifying the resources that are required to actually address those risks. So we do endorse this without amendment. Thank you. So moving on, we're going to Jay and Kayla.
Sure. Thanks, Megan. I'll kick us off and then Kayla jump in. So Section 601, this is a very exciting section. We're very excited to see that this legislation provides an option for tribes to assume administration of the FDIPR program using a self-determination contract or a self-governance compact. This builds upon the success of the FDIPR self-determination demonstration project that was authorized in 2018. And it builds upon it by expanding the scope from just purchasing commodities to administering any programs, functions, service, or activities related to the operation of the food distribution program. And as I mentioned, it also moves beyond just Title I self-determination contracting to provide an option for tribes to use Title IV self-governance compacting. So very excited to see this one. We fully endorse. And Kayla, I'll turn it over to you.
Thanks, Jay. And likewise, the Native Farm Bill Coalition fully endorses this legislation. This, like Jay said, makes a tremendous step forward, or takes a tremendous step forward from the authorization that's currently enacted through the 2018 Farm Bill. We'd also like to thank Senator Murkowski for introducing this on the Senate side. We've been working very hard on the House side, where this language is modeled after and is supported on a bipartisan basis. So we're grateful for the extra support to try to get this provision across the finish line. Back to you, Jay.
Great. So Section 602, self-determination for the Supplemental Nutrition Assistance Program. This is another area that we're excited to see that there's proposed language expanding ISDE authority to the SNAP program. Overall, this provides a tribe the option to assume administration of any function, service, or activity of the SNAP program under a self-determination contract. We fully support it, although we do think that a significant improvement could be made to add the option for tribes to use a self-governance compact as a mechanism as well for assuming the program. As folks know, self-governance is an evolution of self-determination, and it was created by tribes to overcome many of the challenges that tribes experienced with self-determination contracting. In addition, through self-governance, a tribe has the option to keep any and all aspects of Title I self-determination within that agreement. But then it also provides additional flexibilities that a tribe can elect to use that'll help prevent an agency from micromanaging the program once it's under tribal control. So we do feel pretty strongly that we would like to see that expanded to include self-governance as well.
And again, this is another provision that the Native Farm Bill Coalition strongly supports and endorses. We've been working on this one for a long time. There are tribes in certain states that are currently aiding in the assistance of SNAP. And we've seen great success where tribes, for example, in my home state of Minnesota and my own tribe, Red Lake, are helping individual tribal members ensure that they're eligible for the program and receiving the benefits they should. Why we support both of these two sections particularly is that FDIPR is limited to those tribal members that are residing on or near reservations. And so those members who decide to go off reservation for whatever reason, school, work, lots of other things, SNAP is often the program that they utilize. So knowing that in various states, tribes are already being successful in ensuring that their tribal members have access to SNAP, we know that they can do it and they can probably do it better. So with that, I'll turn it over to Kendra to talk a little bit about Section 603 and why this pilot program is also important specifically for Alaska. We may have lost Kendra, so I'll just jump back in here. As you all know, Alaska has unique challenges, given that many towns and villages are separated by hundreds of miles, some of which have no road systems connecting them. And so we also support and fully endorse the pilot program for SNAP administration in Alaska. And we think it could be a great example of how using self-determination to administer federal programs could benefit all, not just tribal members, but others that they may serve in their regions. Julia, do you want to kick us off on Section 604?
Well, actually, Kendra just joined back up, so I don't know if she has anything to add.
Oh, my apologies. I just had some technical difficulties of getting the camera back on. No, appreciate that. You did state it very well, where we do have definitely some difficulties here with how rural we are and our tribes. And, our Native entities have been working really well on these programs, and we know that we can administer our SNAP programs, and sometimes we have some difficulties with the state. And so really going directly to getting that funding directly into our communities is super important. And we have demonstrated on, time and time again that our tribal communities can do this and be able to do it in a really good way to get those funds out to rural Alaska. And so that's a really important piece of this. So thank you. We appreciate that.
All right,
Ju-
thank you. Yeah, Julia, thank you.
Yeah, so and then we have section 604, child nutrition programs, tribal pilot projects, which does three primary things. First, it directs HHS to conduct a study on nutrition programs and health outcomes for Native children in tribal communities, trying to get a sense at all of these sometimes very siloed pieces of child nutrition and taking a look at food sovereignty. And then I'm sure with CDC and other prevention initiatives, taking a look at child illnesses and high rates of child obesity and diabetes in our communities. Second, the second and third provisions came directly out of a bill that was introduced in the 118th Congress called the Tribal Nutrition Improvement Act. The first piece is it provides categorical eligibility for Indian children who are enrolled members to be eligible for free school lunch. So that would be at all types of schools across the country, ensuring that our children have access to food no matter where they are. Second, reimbursement rates here for the National School Lunch Act are also included. To change it to where BIE schools are appropriately reimbursed for the school lunch and other nutrition programs like school breakfast programs that they operate at a rate in which is commensurate with what it actually costs to provide school. A lot of times these schools are using their day-to-day dollars to supplement the funding of the school lunchroom. And the last thing it does is also included in that school lunchroom issue, which is where tribally controlled schools are able to run the grand majority of the school day except for the school lunchroom. And if they're supplementing it with additional dollars, you might have one lunch attendant who is paid for by the school and the other who is paid for through USDA reimbursement. So we actually got a smaller piece of this in the fiscal year 2024 appropriations bill, and it would allow for both BIE schools, but also tribal Head Starts, childcare, or tribal charter schools when tribes are in partnership with local education agencies to be able to apply for a pilot project. What this bill does is it increases the number from 5 eligible entities to 10 eligible entities.
And I'll just wrap up saying any type of programs or authorities we can provide tribes and schools with to ensure that tribal members have access to healthy, traditional, and culturally relevant foods is something that we generally support. And we're hopeful that with this administration, knowing that behind the scenes, HHS and USDA are coordinating on some of these efforts, we are hopeful that we will gain their support, not only in enactment, but in implementation.
Thank you so much. So we're going to move on to Blythe to discuss the housing provisions.
Awesome. Thank you, Megan. So I'll be giving a brief overview of the sections under Title VII, which is addressing homelessness in Native communities. We strongly support this title as it takes long overdue steps to address homelessness. In our communities for decades, tribes have largely been shut out of federal funding streams aimed at addressing homelessness. And so we really appreciate that this title finally creates direct, dedicated resources that also respect tribal self-determination. So starting with Section 701, this section would allow the Department of Housing and Urban Development to set aside a portion of HUD VA supportive housing funding to create a tribal homeless assistance program. The program would prioritize homeless youth, families of children, and survivors of domestic violence. This program would also be modeled on tribal HUD-VASH, which we know has worked well for tribes and tribally designated housing entities. That's for a number of reasons, including that it allows for early intervention before families find themselves in crisis. It supports multi-generational households, and it requires case management. So that provides long-term stability for the folks placed. So one major barrier that we've seen with the tribal HUD-VASH program, despite its success, is staffing shortages within the VA for case management. So we endorse the establishment of this program, but we would recommend that the program should allow flexibility for tribes to use local case management or telehealth services if there are shortages in staffing at the VA. And allowing this flexibility would make the program more accessible and prevent families from losing housing opportunities due to limited staff at the federal level. So that's Section 701. Section 702, this is the Tribal and Rural Continuation of Care Builds Program. This section would set up a competitive grant program to build or rehabilitate permanent supportive housing, especially for those experiencing homelessness or severe overcrowding. And so we know that homelessness can often look different in our communities. It's not necessarily street homelessness. It can be overcrowding. It's couch surfing. So we appreciate that there's recognition of that. This program, at least 75% of the funding would be reserved for tribal and Indian area projects. So that makes this one of the rare federal programs that prioritizes Indian country by design, like from conception. So we appreciate that. Tribes have been technically eligible for COC programs, but without dedicated funding, it was practically kind of impossible to get access. So this provision provides direct tribal specific COC, continuum of care resources. And that would be 25 million in fiscal year 25. We're really grateful, for the recognition of the barriers tribes have faced in accessing COC programs. And our recommendation would be to make the program more accessible by allowing tribal equivalents to meet standard COC requirements. Current COC requirements can be burdensome. They don't accept tribal governance or service delivery structures as eligible under the requirements oftentimes. So our recommendation would be to reduce administrative burdens where possible and add some flexibility there so that this program can be as successful as possible. And then finally, this kind of speaks for itself. And I know we've talked about a couple other tribal advisory committees for the other departments and agencies, but this would make the HUD Tribal and Intergovernmental Advisory Committee permanent, and the TAC at HUD has shown its value time and again, and so we fully endorse this section without amendment. And I will turn it over to, I think, Julia for Title 8.
Yes, thank you. So to start out with, we have Section 801, which basically authorizes funding to strengthen the it's based on Section 20 USC 1057, which already authorizes funding for higher education institutions who might be struggling in certain cases to strengthen their academic quality, institutional management, and fiscal stability. This would offer special consideration, meaning essentially direct the Department of Education to prioritize the applicants who are coming from tribal colleges and universities or native serving non-tribal institutions. And also would include special consideration for programs which specifically serve AIAN teachers or support the development of culturally appropriate curricula. So we support this without amendment. And I have spoken with AHEC about this as well. And then on Section 802, this goes kind of along the same lines. And it would create a pilot project for 5 grantees for Native teacher apprenticeship programs. As you all are likely aware, there are strong teacher shortages in our communities in all kinds of schools. And so this would create a pilot project for 5 grantees at $1 million per year. And it would be tribes, tribal organizations, and Native Hawaiian organizations that could enter into partnerships with higher education institutions to be able to apply for these grants. We would recommend that tribal education agencies are listed as eligible entities because sometimes they exist in a consortia or slightly separate from the direct tribal administration. And so their ability to enter into partnerships with higher ed institutions would be considered parity with what local education agencies and state educational agencies are able to do in similar programs. Section 803, which is supporting after-school programs for American Indian and Alaska Native children, would basically take those core Title VI dollars at the Department of Ed that are the local education agency grants for Indian education and would add as an authorized specific activity of after school programming. Many Title VI programs try and do their best to encourage after school programming and wraparound services, but this would make sure that in every case, it's always allowable and fully understood that that is something that will and should be considered a part of those core grants. Section 804 is curriculum development for American Indian and Alaska Native history. Under Title VI as well, there is state tribal education partnership grant programs where tribal education agencies and states work together, and in some cases even work to develop tribal education agencies out more strongly. Under this, this would authorize one of the specific activities delineated in the statute to be developing curricula to teach American Indian and Alaska Native history. We would recommend that this be amended to say history and culture. Under some of the other allowable activities in statute already, it says development of traditional knowledge and traditional leadership. But when we're discussing curriculum specifically, we would encourage history and culture so that we're not just facing a very narrow definition for social studies, but we're able to expand the curriculum conversation into more areas of the school day, like the maths and sciences, to fully incorporate the curriculum necessary. Okay, and then 805. So first up is completing the Durbin Feeling Native American Languages Act survey. You guys might recall that in 2022, the Durbin Feeling Native American Languages Act and the Native American Language Resource Center Act both passed. The Administration for Native Americans was in charge of implementing and is still in charge of implementing Durbin Feeling. And in that, the first step was to conduct consultations on how to conduct a survey of Native languages. They've taken that first step. However, they have not had the funding necessary to go from having crafted the survey to actually implementing the survey, much less going from the implementation of the survey to the report and then even to the implementation of any of what the report's findings might encourage. It's a more multifaceted process, and the initial appropriations were not sufficient. So what this section does is it first of all directs HHS and the Administration for Native Americans to complete a report outlining the timeline required to complete the report. And while we think that this could help Congress understand exactly why there are barriers here, it's our stance that a report on why the report hasn't been fully finished isn't necessarily the best use of money or time. Rather, we've heard directly from ANA, and they've had some shakeups, so I apologize for not having a specific number here. But we have heard from ANA that they know exactly already how to fully get to the finish line, not quite to the implementation of findings, but to fully having the survey out, having the report together and published. It's just a matter of funding. And so if Congress would just give them the money, they would be able to fully accomplish it. That is what our recommendation is, rather than a report on a report being slow. But there's also a second piece to this, is it also adds a couple of pieces in here that are really strong, which specify exactly where pieces of the report need to go, and then specific information they would like to see collected from Native American Language Act programs, NALA programs. And I think that that is actually something we very much support because we'd like to see where federal funding is going and exactly what the impacts and benefits of that are so that we can show them off and look at how our programs are succeeding. Section 806, addressing the indirect administrative costs of Indian education programs. I won't go into over detail here because it's predominantly a administrative fix to three main sections. Title I, Indian education grants to LEAs, or Title VI, Indian ed grants to LEAs, like we discussed prior. Title VI, Indian education special programs, and Title VI, Part A, Native language funding. It essentially, across the board, ensures that direct administrative costs are specified as being able to be used on all of them. There's a max 5% use that's already in statute. This would allow them to, instead of rely on annual appropriations for administrative costs, for their administrative costs under that 5% cap, to be allowed to be used within 5 years, which allows for better planning and implementation of programs, especially if you're starting a new program or expanding, needing to staff up or refocus, that it allows for longer term planning, which would encourage the success of these programs. But again, would still maintain under that 5% cap. So the other 95% we would ensure does actually go to the programs and to the children themselves. Section 807 is improving tribal Head Start functionality. We've already gotten some major parity wins over the past year for American Indian Alaska Native Head Start, the primary one being the authority to choose their own eligibility standards and implement them. But this section would take some of that one step further and offer better parity and even beyond states to allow these grantees to use funds for Head Start facilities, either for acquiring or maintaining them. This has been a long-term ask of the National Indian Head Start Directors Association because these are grants, there's not been funding necessarily for these facilities in the past, and it's not been an allowable use of those funds. So tribes have to find some other mechanism or add on some other building to be able to fund these facilities. The second thing this section does, is that it extends the non-federal matching requirements to within 5 years for the waivers. At the moment, AIA and Head Starts are able to get a waiver for 1 year, which is helpful for short-term grants. But as you all likely know, longer-term grants within the 5-year range are more likely the sort of things that are going to actually help these programs develop capacity out. And so by increasing that matching requirement waiver timeline, it will allow them to apply for longer periods of time. Section 808 is addressing homelessness in BIE schools. It increases the McKinney-Vento Homelessness Act set aside for the BIE to 2% from 1%, so it would double it. It does have a hold harmless section for states to make sure that both states and tribes in this scenario are provided for. And then it also allows the use of funds to include emergency housing, which is really essential for BIE schools because there are any number of scenarios in which you last minute have to find programs and support for your students that might not have come up previously. On Section 809, supporting BIE home visiting. The BIE currently has something called the FACE program, the Family and Child Enrichment Program, which is not in statute currently, but is a program that they've been developing on because it helps increase kindergarten readiness and better support for the family unit as you're entering into school systems. In this case, it would specifically codify the FACE program and authorize $20 million annually for that. The FACE program provides specifically for family enrichment, pre-kindergarten services, and adult education services, and has been a fairly successful program that's really brought the whole unit, the whole family unit and support system and tribal community to the table in a way that is more in line with community education values.
Thank you so much, Julia. I think this next one is you and Jay.
Yeah,
Sure.
so I can start off and just like describe the why if Jay wants to describe the how. Does that work?
Sure.
So in the 477 program, there are a lot of programs that specific within ACF that specifically apply to children. And so everything from ANA, Child Care Development Block Grants, Native Languages, Head Start, and workforce development programs, numerous programs apply to youth and children. And we've had varying degrees of success and frustration at trying to get these different programs, specific authorizations to be lumped together for various reporting requirement concerns or other specific authorizations. And so that is where this 477 conversation really came out of, wanting to make sure that a lot of the ACF programs were all able to be bundled together. This has been a long time ask of ACF TAC. And then I'll turn it to Jay for the how.
Sure. So, thank you, Julia. Overall, we see these very positive, technical and clarifying corrections that overall should make it easier for tribes to justify the inclusion of more programs and also provide some administrative efficiencies. So, for example, it adds language really emphasizing that programs and services that foster economic security, stability, or well-being for families, children, and youth are eligible. It also emphasizes self-sufficiency as a primary factor in program eligibility. It also provides clarifying language about reporting requirements by specifically stating that the only report required to be submitted by a tribe is the single plan report, and that a waiver is not needed to eliminate other programmatic reporting requirements. And then lastly, another efficiency is that it clarifies the inclusion of a program in a 477 plan does not modify, limit, or otherwise affect the eligibility of the program for self-governance compacting. Previously, the text was limited to saying self-determination contracting. So overall, we strongly endorse this and believe these are great clarifying corrections.
Thank you. So hold on. Sorry, I have too many screens open. So section, let's hold on. So I apologize. Okay. So we're moving to David for section 902.
Sure. So section 902 is pretty simple. It just increases the tribal set aside from the Child Care and Developmental Block Grant from 2% to 5%. This is one of the most widely used programs by tribes. I think there's almost 500 tribal grantees. So, and it's been at, the current set aside has been at 2% for many, many years, almost since its initial authorization. So much needed.
Thanks, David. And then section 903 adds a tribal consultation requirement to the Child Care and Development Block Grant statute and requires the secretary to consult with Indian tribes and tribal organizations on the development or on the administration of these block grants. So we love tribal consultation. We love it even more when it's in statutes. So we endorse this as well. So moving on to the early tribalhood TAC, that goes back to David.
Okay, so section 904 establishes a tribal advisory committee at HHS on early childhood within the Office of Early Childhood Development. This is under the Administration for Children and Families at HHS. And a task is, like many, are going to be looking at solutions, policy recommendations to improve programs for tribes that support early childhood development, which is a number of different programs. And the way that they talk about it in the amendments, if you read it, you'll see they talk about it broadly. So it talks about child care, it talks about maternal health, it talks about Head Start kinds of child development too. So lots of things there. There's also some data collection, and then they use the language of surveillance, not sure what that means exactly. And then also providing guidance on tribal consultation for early childhood initiatives. So as we looked at the legislation, I get back to my screen here. As we looked at the legislation, we thought there could be some clarifying amendments. with regard to sort of the qualifications of advisory committee members. It's real technical kind of language. It's not meant to be substantive. Also, understanding what they mean by surveillance as part of the duties of the TAC would be helpful too. And some of the other, we noticed in some of the earlier sections where they were creating tribal advisory committees, they often had a provision that prohibited appointment of federal employees on the TAC, and this one did not. So we recommended adding that. And then just a little bit more information or clarification about sort of the interface between maternal health, child development, and child care issues and services, because the advisory committee will be working within all of those areas too. That's it.
That's the legislation. Just a reminder, please put your questions in the Q&A box, not in the chat, because with the time left, we're probably not going to be able to get to all of them, and we want to be able to answer them, and this way it saves them. So if you go to the bottom of your Zoom screen, to the left of the share button, there is a icon with a question mark, and that's the Q&A. So please put your questions there and not in the chat. So to provide feedback, NCAI will be drafting up a comment letter, and we're seeking additional feedback from our member tribal leaders and organizations by September 3rd. So we can incorporate that by Senator Murkowski's deadline. So if you could submit that feedback to policyinfo@ncai.org, we would appreciate it. And then Chairman Murkowski is seeking public input on the discussion draft by September 12th of this year. And feedback should be emailed to Murkowski_outreach@indian.senate.gov. And those two emails are linked in the slides, and the slides will be made available on the NCAI website by the end of the week. Next slide. We also have points of contact for all of our presenters today. If you need to reach out to any of us and you have additional questions, our emails will be available on the slide deck that will be on the NCAI website. Next slide. And we want to thank you and everyone for the participation. We've got a few minutes left, so I'm wondering if any one of our panelists has checked the Q&A. I know a number of questions have been answered already. If they want to go through, if anything specific in the Q&A box has that you want to address while we're still here. So, and then also the recording will be made available on NCAI's YouTube website as well. And what we plan to do is take these questions that are in the Q&A box, and we'll have answers and place them on the website, hopefully by next week, so everyone can see the answers to these questions. So with that, I think we can end a few minutes early unless any of our panelists have anything else to say. I really, really want to thank our panelists today and our sister organizations. Getting this done so quickly was a feat, especially Kayla, who helped organize all of us and organize us. But I especially want to thank Senator Murkowski and her staff for getting this wonderful legislation done, as well as the commissioners on the Commission for Native Children. I often get worried about commissions because sometimes the recommendations come and they're never implemented. And I think it's a testament to their work and to Senator Murkowski's passion for this area that we have this remarkable legislation coming out of it. And I'm thankful for everyone that participated today because I know that Senator Murkowski and her team will take these comments into consideration and make the legislation even better before it's introduced in the Senate. So with that, I want to thank everyone again. The slides, the video, everything will be available with enough time for you and your tribes and friends to review as you're thinking about and writing your comments. And again, our contact information will be also included in the slides on the website. So if you need to reach out to any of us with additional questions, we'll be happy to answer those for you. So have a great day, everyone, and thank you again.